ER doctors, what's the worst state a person has come in? ER doc here. Had a nurse come grab me while I was charting. Doc, you need to see room 6 right now. For those of you who don't work in the ER, when one of the nurses tells you to go see a patient, you run. I took a few steps towards room 6 and the smell hit me like a truck. I gagged on the spot. I peered through the glass doors of room 6, and noticed a well-appearing, young female. Because she looked so well, I knew I could spend an extra minute taking a quick detour to find a handful of alcohol swabs that I promptly opened and shoved in my mask to help quench the smell. I walk into the room and find this young 30-year-old female with her leg inside a trash bag, sitting next to her parents and family. They do not seem fazed by the rancid smell. Meanwhile, I hear one of our veteran ER nurses vomiting in the background. I introduce myself to everyone, and ask what brought the young lady to the ER, and why her leg was in a trash bag. She starts not by talking, but by simply removing the trash bag. And there I saw it. A monstrous tumor protruding from her tibia. She then proceeds to explain, it started 6 months ago with a cut that wouldn't heal. It then changed to appear like a fungal skin infection. She Googled it, and was confident in the diagnosis. She decided to treat it by starving it of sugar, and going on a sugar-free, vegan diet. Eventually she convinced her whole family to do the same in order to help treat the infection. And then about a month prior to her visit today, it was too large and painful to even walk around, so she's been living in her room at home taking virtual online college courses. She added that she's lost 30 pounds since the infection began siphoning the nutrients away from my body a few months ago. Because it grew and developed so slowly, her family and herself were completely acclimated to the smell and didn't notice anything. By this point in the conversation, I heard another nurse vomit. I then sat down and delivered the bad news, that this was not a fungal infection, and likely advanced cancer. That we would be admitting her to the hospital for further workup and surgical resection.